Massaging and pressing acupuncture points to support pregnant women during pregnancy. Hi. The term morning sickness is used to refer to nausea that increases during pregnancy and is especially common in the first 3 months of pregnancy. In fact, morning sickness usually starts around week 6 and lasts until around week 12. At that time, pregnant women often have a feeling of nausea, possibly accompanied by vomiting, and sometimes accompanied by other symptoms such as headache, dizziness, fatigue, and sweating, etc. Although the exact cause of morning sickness is unclear, factors such as heightened sense of smell, certain foods, fatigue, and emotional stress may contribute to the condition. However, science has also shown a very clear correlation between morning sickness and hormonal changes, especially an increase in the concentration of a hormone called chorionic gonadotropin, abbreviated as HCG, in humans. This is a hormone produced by cells surrounding the developing embryo, immediately after fertilization and implantation in the uterus. This hormone is an important sign in early pregnancy detection and plays an important role in maintaining the corpus luteum, which in turn produces progesterone in the early stages of pregnancy. It is the presence and level of HCG in a woman's body that is a reliable sign in pregnancy tests. Levels of this hormone increase rapidly during the first few weeks of pregnancy, peak at about 8 to 11 weeks, then gradually decrease and stabilize for the remainder of pregnancy. Although morning sickness is often considered a normal part of pregnancy, confronting the symptoms of morning sickness is not easy for many women. In fact, the severity of morning sickness is different for each woman. Some feel only mild discomfort while others may feel it more intensely. Severe cases of morning sickness can include a constant feeling of nausea, and sometimes an inability to keep anything in the body, including water, leading to dehydration and electrolyte imbalance. Such cases require hospitalization to receive intravenous fluids. Medical experts often recommend that women with morning sickness eat small, frequent meals, drink enough water, and get plenty of rest. At the same time, you can also consider using some suitable foods or drinks, such as sipping crackers and drinking ginger tea. The massage and acupressure exercise that I would like to introduce to you today are also a good choice for pregnant women and can help you quickly reduce the discomfort caused by morning sickness. Sincerely give to you. To practice this exercise effectively, you must know exactly where and how to take the following important acupuncture points. The Naguan acupoint. The two-way acupoint. And the Tsuchi acupoint. Concretely, please pay attention and practice with me. To practice this exercise well, we should sit on a sturdy chair like this. First of all, we practice pressing the Naguan acupoint. Each of us has 2 Naguan acupoints located symmetrically on our 2 wrists like this. The Naguan acupoint is the 6th acupoint located on the pericardium meridian, located in the center of the inner wrist. 2 cun from the horizontal line of the wrist joint. You can review the location and how to get the Naguan acupoint in video PC6. Here, this is my Naguan acupoint on my left wrist. It is located in the gap between these 2 very large tendons and is 2 cun from the line across this wrist joint. Here I want to talk about 2 situations. When in a fit of nausea, we use strong and drastic tactics. And, when there is no nausea, we will use mild stimulation and calming techniques. Concretely, 1. First situation, emergency response. To prevent and block impending or ongoing nausea, you can immediately press firmly on the Naguan acupoint on any wrist. You can use the tip of your thumb to press firmly on the Naguan acupoint like this. Press as hard as you can handle. But remember, the higher the level of nausea, the harder you press the Naguan acupoint. Such a pressing action lasts about 10 to 20 seconds. Then you continue to press rotate, still using the tip of your thumb to press rotate the Naguan acupoint like this. Of course, the pressing rotating force, although much lighter than pressing, is still relatively strong. The pressing rotating force on the acupoint is lighter to prevent bruising, but still strong enough to continue to impact the Naguan acupoint, in addition to pressing hard as above. The time to press rotate the Naguan acupoint like this also lasts about 10 to 20 seconds, similar to the previous press time. Then you move on to pressing and pressing rotating with the same techniques and timing, as I just practiced on my left wrist. You also use the tip of your left thumb, pressing hard on the Naguan acupoint like this for 10 to 20 seconds. Then, still using the tip of your thumb, press rotating relatively strongly on the Naguan acupoint, also within 10 to 20 seconds. You can repeat the pressing and pressing rotating cycle on one wrist, and then switch to the other wrist many times. Saying many times here means many times, maybe 3, 5 or even up to 7 repetitions depending on your needs. This is the first important acupressure point to practice to help you fight morning sickness, which is very miserable for many people. In fact, there are many cases where just practicing like this on the Naguan acupoint and turn on each wrist has had very clear results, and even without having to practice any other acupoints. 2. Second condition, prevention. When pregnant women are in a normal state, without the above-mentioned morning sickness attacks, they can still use the Naguan acupoint to prevent it. At this point, you can still use any fingertip. It's even best to use a finger joint like this, pressing rotating lightly on the Naguan acupoint. At this time, the impact on the Naguan acupoint is very gentle and gives a very positive feeling. You can feel very high with the very special, indescribable, and very characteristic feelings of pressing on the acupoint. The time of pressing rotating on such acupoint can last up to a few minutes. Then, you also massage the acupuncture point just like this for a few dozen seconds. And you do the same for the Naguan acupoint on the other wrist, also with the same pressing, rotating, massaging, and timing techniques. Thus, I would like to reiterate that, for the discomfort caused by morning sickness, pressing and pressing rotating the Naguan acupoint alone can be very effective, even enough for many pregnant women. However, there are also many cases where many women also have many other symptoms that appear at the same time as the above-mentioned nausea or vomiting. At that time, you can practice stimulating some of the following acupuncture points. First case. If morning sickness pregnant women often have additional symptoms of headaches, in addition to pressing and pressing rotating the Naguan acupoint as above, you can further stimulate the two-way acupoint. You can review the location and how to get the two-way acupoint in video ST8. The two-way acupoint is the eighth acupoint located on the stomach meridian, located at the corner of the forehead, on the intersection between the two hairlines on the forehead. Each of us has two two-way acupoints located on both sides of the upper corners of the forehead. These are my two-way acupoints. To press the two-way acupoint, you can use two fingertips, index finger or middle finger, pressing directly, pressing hard on two acupoints simultaneously. The techniques used here are pressing and pressing rotating. First, we press firmly on the acupuncture point within your pain threshold, within 15 to 20 seconds. Then, immediately use the tip of your finger to press rotate on the acupoint like this, for the same amount of time as the time of pressing the acupoint just now. You can repeat pressing and pressing rotating two-way acupoint like this, about 3 to 5 times, or a little more if you want. However, you should not be too eager to press too hard, and for too long, too many times in a short period of time, to avoid causing bruising and damage under the skin. And, second case. If morning sickness pregnant women often sweat a lot, in addition to pressing and pressing rotating the two-way acupoint mentioned above, you can also press the Tsuchi acupoint. The Tsuchi acupoint is the 11th acupoint located on the large intestine meridian. You can review the location and how to get the Tsuchi acupoint in video LI11. Each of us normally has two Tsuchi acupoints located symmetrically on our two elbows. This is the Tsuchi acupoint on my left elbow. When we bend the elbow almost perpendicular like this, the Tsuchi acupoint is in the depression right at the outer end of this horizontal crease. There are many effective ways to influence the Tsuchi acupoint, but for this exercise, to reduce the symptoms of sweating during pregnancy, you should apply the pressing rotating technique with varying levels of pressure. Now press rotating your Tsuchi acupoint like this. First, slowly press on the acupoint while pressing rotating your fingertips like this, so hard that you feel uncomfortable, then stop, and continue pressing rotating at that level, and then reduce the pressure. The force of pressing rotating is gradual, meaning we press rotating more and more gently each time. Then you continue pressing rotating to increase the pressure, then slowly pressing rotating to reduce the pressure. You should continuously press rotate the Tsuchi acupoint like that for a few minutes. After finishing pressing rotating the Tsuchi acupoint like that on this elbow, you immediately continue to press rotating the Tsuchi acupoint on the other elbow, also with the same techniques and time of acupressure. So, I would like to reiterate, pregnant women suffering from morning sickness can press and press rotating respectively on the two Naguan acupoints, on the inside of the two wrists. When experiencing nausea or vomiting, apply these techniques. Strong pressing and pressing rotating techniques. And, in normal times, you can press rotate gently on those Naguan acupoints in turn when you have free time, to prevent it. If that's all the problem is, then you can just practice like that. Just pressing and pressing rotating the Naguan acupoint is enough. However, if you have other symptoms, In addition to pressing and pressing rotating the Naguan acupoints as above, you can press 1, 2, or all 2 more acupoints, depending on the condition. The two-way acupoints to relieve headaches, and the Tsuchi acupoints to reduce excessive sweating, with the same tips and durations as we just practiced above. Wishing you and your baby health and happiness. Thank you. Goodbye and see you again.